Welcome back to Heal and Learn, where we are focusing right now on channel theory and we're learning on how to heal the body using channel theory. So, I think I've made maybe 3 or 4 videos at this point about channel theory and why it can be so effective and why we can use it. And I hope my fellow acupuncturists, the acupuncture students, are starting to learn it and grasp some of these concepts. I just first want to kind of like review some of these key things. And I think this is important because channel theory is a very complex topic. And so I'm trying to just like help kind of put all these puzzle pieces together. So, last video went over the 5 systems within channel theory, and that is going to be, which is the same name. So that means hand tai yin is also bracketed with foot tai yin. So this is just hand and foot bracketed pairs is system number 1. So that'd be the same for Xiao Yin, so hand and foot of Jui Yin, hand foot Yang Ming, hand and foot Tai Yang, Xiao Yang. Okay, so hand and foot, that's system number 1. System number 2 is going to be branching names. So that is going to be Tai Yin to Tai Yang, Xiao Yin to Xiao Yang, and then Jui Yin to Yang Ming. Okay, so those are the couples within that. So Tai Yin and Tai Yang, Xiao Yin, Xiao Yang, those ones are easy because just the opposite of Yin and Yang. But then we have Jui Yin and Yang Ming. Those don't have the same prefix or the same root of the word, but they are Yin and Yang opposites. Okay, so with all of that, within the branching, it is also going to be hand to foot. So hand Tai Yin will go to foot Tai Yang. Hand Xiao Yin will go to foot Tai Yang. And then we can go opposites too. So it's not always just yin to yang, but it's also going to be hand Yang Ming to foot Jui Yin. So the yin yang aspect can be on either side, and the hand and foot aspect can be on either side. They just need to be opposing. Okay. And then third system, interior and exterior, which that is just following our little zigzag of our flow. And so Tai Yin will go to, or not even that, hand Tai Yin will go to hand Yang Ming, which will then go to foot Yang Ming, will be coupled with foot Tai Yin. So this is going to be hand to hand, foot to foot, hand to hand, foot to foot. So that zigzag will continue like that. Then the fourth system, we have clock opposites. So that is just going to be an AM to PM. And this again will be hand to foot. Hand Tai Yin, which is 3 to 5 AM, and then it would be foot Tai Yang, 3 to 5 PM. So it's just truly hand to foot, AM to PM. And then the fifth system is going to be the clock neighbor of the same polarity. So again, we're just saying clock neighbor, but if you just kind of have your flow, then it's going to just follow that flow. So starting with Tai Yin, that's actually going to be Jui Yin. So it's going to be like feeding into that. So it's whoever like fed into the next or like the previous thing, that's going to be the flow. Okay, perfect. So that's our little recap of just examples. I'll have my little slides up. So I posted some of those examples just at the end. I wanted you guys to practice those, understand those. So going through some more examples, I think it's pretty straightforward on how to be figuring out this math. And I feel like it's like math. It's really just like a puzzle. So you have this diagram that's saying this is the whole breakout of hand Tai Yin and all the 5 systems that potentially are paired with that. And now it's up to you to decide how do you want to treat. So with that, there are a few things to be taking into consideration. It's going to be the 5 systems. So map those out. And then the second thing we need to figure out is, are you doing the needling on the same side, the opposite side? Where are you needling? So again, I'll give you a little cheat sheet. You just have to like learn that. there is like, again, you can see the pattern systems 2 and 4 versus systems 1, 3, and 5. And so you just kind of like will start to learn that and use that in your practice. Third thing you should be just thinking about is the anatomical correspondences of those joint types and of those skeletal systems. Are those going to be similar? Is that another way to enhance this treatment? So again, if somebody has shoulder pain on Sanjiao, then one of the anatomical correspondences that you could think about is how it's bony and it's bony, it has a lot of tendons coming onto it, and so gallbladder 34, stomach 36 areas, those would be very similar. Of it's bony, it has lots of tendons attaching, and so remember the elbow to the knee is a image to each other, and gallbladder 34 is our point of sinews, so that could be like a fantastic point because that'd be same name, Shaoyang, along with anatomical correspondences, and we can think about the imaging and the mirroring with all of that. Another thing that you could be thinking about when you are actually needling is, let's say again, it's just a tendonitis you have in your elbow. You would want to be needling in the tendon of your elbow, so you would want to be needling in the tendon of your knee. So needling into tendon will treat tendon. Needling into bone can treat the bone, so people will tap the bone. Liver is notorious for being scraped with your needle, so you could be treating things like that. So bone to bone, skin to skin, you can be very superficial to be working on very superficial issues. And so all of this starts to play into a bigger role into how to be treating. Another thing I just want to talk about a little bit more is the imaging. So I feel like we're making sense with all the mirroring and how we can reverse the mirroring, and I think that is all like making sense. If that's not, then let me know and I can clarify. The imaging is where it gets a little bit tricky because the imaging can just start to feel like a free-for-all. So one of the ways, and this is also a way it kind of feels like a free-for-all, is there's so many textbooks with so many fantastic practitioners who have had their 2 cents in their clinical practice and it works for them, and so then a lot of people adapt and start to use that same way of imaging. Okay, so with these images, knees and your elbows are always imaged to each other. So again, like if we were just taking like my limb to limb, my knees and my elbows would always be connected. Those are like the pivot points. So if I'm doing true imaging, if I'm doing reverse imaging, it doesn't matter. My knees and my elbows always stay consistently paired together, okay? So if we were to say that we want to work on the full body, so from shoulder to my fingers, and I want to image my full body, then my elbow, my cubital crease, would be my belly button, my abdomen, okay? And so that's going to be the image. And so from there, you can either rotate this to be the top of my head or my feet, however you want to reverse my whole arm, okay? And so if somebody is coming in with stomach issues or things like that, then you could like be using your whole arm to be finding that image and kind of seeing like which way do you want to be using and going, okay? So again, that's just one aspect of it. Another way that people use common imaging is however their body just naturally lies. So if you are laying down on the table, your cubital crease naturally kind of lines up with your belly button, right? If you're just like laying down there. Another thing is people typically, like when they're laying down, have their hands in like their groin, like holding, like just kind of like relax like that. I think it's just a normal way of like placing your hands palm up, on your body. So you could be using your index finger to be treating erectile dysfunctions because your fingers are naturally there. And we also know that Yang Ming is full of qi and blood. So if that's the reason why you're not getting erections, then that could be a way to be treating it. And so there's just like all these little ways to be focusing and healing the body like that. Okay, let's see. So I want to just do a few more examples within the imaging of the full body. So with all of this, we're saying that the top of the shoulder is going to be the top of the head. Okay, that's going to be like our do 20. And then going into the shoulder a little bit, that's going to be our neck, our jaw, our base of the skull. So that's just another way of treating the full body. So again, belly button is going to be my elbow, my cubital crease, and so the top of my shoulder will be my head. And then my fingers will actually be my Ren 1 or my testicles. So again, going back to the erectile dysfunction, not only are your hands naturally laying next to your genitals and like in your groin, just relaxed, they also would be imaging that is your do 1. Your hand could be your genitals, your sacrum, your coccyx. That makes sense. Again, we use pericardium 7. Some people call it pericardium 7.2 as your period point. And so like that would be imaging to your uterus and like helping you relax to bleed and taking care of like that PMS type of things. Again, that's a Jue Yin pairing, and Jue Yin is all about the free flow of blood and making sure everybody can be relaxed while we're free flowing, right? The wrist could also be the sacral area, which again, SI6 is fantastic for sacral pain. And think about also how you have 8 carpal bones and you have the Ba Lao, which is the 8 sacred holes. So 8 and 8, it's not a coincidence. We can just kind of like start to see how everything is meshing and flowing together. Another thing is just working our way down. Belly button's going to be our umbilicus, our L2, our waist, and then our upper arm would be our upper abdominal, our rib cage, our chest. And so all these channels and these areas can be used. And so you can start to mix and match of like how I'm saying Jue Yin helps with the free flow and calming the Shen. That is using imaging along with the system pairing of the same name. So you want to be able to start to combine things together, okay? Great. So that is a way of like really just breaking everything down into how it works. Let's go into some examples. So let's say a patient is coming in with acid reflux. So if a patient is coming in with acid reflux, you can treat them Zong Fu if you already see that and you can treat that. That's great. If they're not getting relief with that, then you can also use applied channel theory to see if that's going to be a better treatment and helping the body relax fully. Okay, so acid reflux, this could be morning sickness, heartburn, nausea. It doesn't really matter. It's really just like this upper GI tract coming in. So in this scenario, we are thinking about literally what are the meridians under our esophagus and our gastric, our abdomen. So when we start to think about like what is happening, we could say that's our kidney meridian. We could say this is our stomach meridian. Our stomach is nauseous, right? And so it's coming up. So those two would be our 2 biggest meridians. We could say our Ren channel, of course. Ren is not played into applied channel theory nearly as much as others. Again, what we would do is we'd look at our affected channels and then we'd list out systems 1 through 5. We see if there's anything in combo or in common with any of that. And then whatever is in common, we could be focusing on treating that. So Jue Yin would be one of the ways that they both have in common. And so you could potentially just be using Jue Yin and working on that. So Jue Yin is on system number 4 for the Yang Ming, and then we have Jue Yin for system number 5 on the foot Shaoyin. So those two in common. So now we can just kind of go based off of all of that. But there's all these other options that are laid out for you. And so they even have things of what would Ren be and using the imaging. Okay, so we could be using do 20 to do 22. And so that would be like the way of like working our way up, which would be, because it's do 24 to do 16, that's the whole line. And so do 20 to do 22. Those would like be our areas of, because do 20 would be our belly button. And so then working our way up. So those are like our options. So another one is again abdominal pain, where we would look at what are our affected meridians. We have foot tie-in, so that's our spleen. We have the yang ming, which is our stomach. We have the kidneys, and we have the ren. So again, we have these 3 meridians that are being affected. You would look at all 3 of them. You'd see if there's anything in common, and then go based off of that to see like what could be the best type of treatment for you. And this is like the best way to do it. So I'm gonna just keep giving you guys examples, keep giving you guys all these notes, because these are just like fantastic ways to be learning and to be practicing, whether you're in school or as a practitioner, to see what's working best for your patients. And so one of the main things with channel theory is you can kind of just follow and chase the pain. So whether it's they're currently feeling nauseous, you could immediately get results, or you can start to see, did your results of using applied channel theory last way longer than when you use Zong Fu traditional points. So just lots of options within acupuncture, and the whole goal of this is to get more comfortable using applied channel theory and seeing what works for you and your patients. So as you just continue to practice and study this, it becomes easier and easier to just like know what you're going to do and kind of see how it works. So good luck. I hope you continue to be practicing this and be on the lookout for another video. The next video that we're going to talk about will be systemic problems, okay? At this point, we've only worked on localized, so I'm locally tender in my stomach, I'm locally feeling acid reflux, I locally have joint pain in a joint. The next will be systemic, so my whole body is inflamed, autoimmune conditions, your whole body is at play here, and how are we going to use applied channel theory to balance that out? So stay tuned, and I will see you guys soon.